Hello and welcome to today's Here's to Your Health podcast. I'm your host, Don Lintzman. My guest on the podcast today is Trama Vetter. Trama is the Director of Clinical Services here at CCMH, and Trama, thank you for joining me today.
You bet.
Before we go any farther, I'm going to guess that there are a significant number of people who are in the audience today who probably don't know who you are or where you come from. So let's just talk about that just a little bit. Introduce yourself to the folks who are listening today, a little bit about your experience and your education.
Yeah. So my name is Trama Vetter. I have been a nurse since 2011. I graduated with my BSN in 2020. I was accepted into a pediatric nurse practitioner program back in 2021. I went to Children's Omaha and worked there to gain more experience, but I soon learned how much I miss being in the clinic and being involved in the community. So I do take pride in gaining the trust of our patients and being active in their health, not just for that 12-hour shift, but also the rest of their lives. As a clinic nurse, we become our patient's advocate, and that is very important to me.
Over the last few weeks, we've had a number of conversations with different people in the building about some of the challenges that we face in healthcare, shortages in particular areas, difficulty in hiring, so on and so forth. But that's true across the United States, and we see that obviously in our building, but also in the medical clinic. So let's talk about that just briefly.
Yeah, so our medical clinics, they do face numerous challenges. Some of that is the cost of living, the cost of the financial strain. There is a shortage in healthcare in general. So I will say that, at CCMH here, we do know that there is an increase in the needs, though, still of those patients. So our clinic in itself, we are growing. We have added lots of nursing staff. We have also added providers, general providers. We know that there is a need in the community with acute appointments. We have added Kylie Martin. She is a family practice provider, and all that she does is she does not have her own established care. She actually has her own patients for just acute availability. So our team is continuing to grow, but that is so that we can support our community needs in general.
And I think one of the challenges that you face, and one of the things that we see a fair amount, are things that you talked about, and that's associated with rising costs. Mm-hmm. I mean, obviously nothing in life is free.
Right.
But, costs are a huge part of this. Some of it we can control, a lot of it we can't. So maybe you can give us a really quick window into our ability to contain costs for the benefit of our patients.
Right. And I will say, so, CCMH in itself, we are just like any other business, any other surrounding hospital. We do not, we want to give the best care, but to be honest, we're kind of limited sometimes. And sometimes that is based on patients' insurance coverage. We have primary insurance, we have Medicare, Medicaid. I think that what we need to understand is that our charges are subject to the insurance companies and the federal regulations on how much we can pay for those covered services. So, ideally we would love to give free healthcare, but that's not reality.
And I think your point is one that's well taken. I do think that there's a misunderstanding in the public that we can set prices wherever we want to, but what you said is true. Between Medicare and Medicaid and insurance companies, they pretty much set the prices for us. The rules and regulations being what they are, you can only charge so much, and then they're only going to pay so much of that charge. So that's how this system works for us. We talk about a healthcare system, but we really don't have a system as much as we have lots of different people who are involved in lots of different moving parts, and sometimes those don't fit together very well. And in this particular instance, I think that's what we're talking about.
Yeah, and I will say I do agree with that too. I think that it is important for us to actually truly understand our insurance coverage that we have. I think there's a misconception out there too that, I'm insured. but what does that mean? What does your insurance cover? And I think that is something that even myself, I'm like, oh, I think this is covered, but is it? So I kind of encourage each patient to really look into that too. I will be honest, there are times in the clinic where we have patients that come in and we do good faith estimates, and sometimes it's alarming to those patients what their insurance truly doesn't cover. In those certain circumstances, what we do is we do have an amazing financial counselor group that is willing to assist. And so I guess for me, I think one of the things that I encourage our patients to do is truly understand your coverage.
My guest on the podcast today is Trama Vetter. Trama is the Director of Clinical Services here at Crawford County Memorial Hospital. You're listening to the Here's to Your Health podcast. You know, one of the things people don't pay attention to, I think, Trama, unless it happens to them, is cybersecurity. I think for the people who are listening at home today, they may understand that maybe they've had their own personal account hacked. Maybe somebody has stolen their credit card or their debit card. So people get their identity stolen. And for us, you know, so far so good, but we know that that constant threat is out there.
Absolutely. I will say that our IT department, they do a fantastic job trying to protect all of our patient data. We do utilize an amazing amount of technology to make sure our data is safe. I will say, though, that there are two issues that impact our cybersecurity. One is the constantly evolving regulations that govern how patient data is collected, and two is the adapting technology. While our goal is to protect the patient's data by all means, unfortunately that also does mean cost of money as well.
And we have a new electronic health record software. Sometimes it's so good even we can't access the patient's data.
Yes.
But maybe that's a good thing. But the other part of it is, you know, that's not inexpensive either. I mean, all of these things cost money, and we're doing our best, I think, to be able to manage that information in a way that makes sense for everybody, and by the same token, make certain that we can keep costs under control. We're not going to talk about the patient portal today. That's a discussion for another day.
Sure.
But that's also a part of our electronic health record, and we'll come back to that soon with one of our IT department members, and then we'll talk a little bit more about the patient portal, how you access that, what kind of information is in there, but that's a somewhat of a different function that we'll talk about later. While we're still talking about patient care, though, let's talk about what you said earlier about Kylie Martin, who is here seeing patients same day and walk-in appointments. What kinds of mechanisms do we have in place in order to try to see as many of those patients as we can?
That is a great question. So obviously, you know, I think something that maybe we don't fully understand is we really do have a busy clinic. You know, for instance, on this last Monday, our clinic took over 400 phone calls, and on average we see anywhere from 200 to 250 patients each day that we have our business open. I will say that scheduling acute appointments is very dependent on the need of the clinic. For instance, if we have flu season, we know that we're going to see an increase in that acute need for those patients. So what do we do about that? I will say that we have an amazing patient access manager who I collaborate with, and each day we're looking to see where is the need of the clinic, what was the trend last week. We are being proactive, and we're blocking those providers' schedules. One thing that we also do is we kind of look ahead. We look to see do we have providers that are off for either continuing education or vacation, or do we now have an illness that we have to accommodate for? So what are we doing? We're being proactive, and we're blocking those schedules to accommodate those needs of the patients.
What would you say to the patient who needs to come in and see someone because they need blood work done, or because they need to do an annual wellness visit or whatever? They get frustrated because it might take them a few days or maybe even a week to be able to secure an appointment to be able to come in and see their provider. What would you tell them about how this system works and why it sometimes might take us a while to be able to work them into the schedule?
Yeah, and I can see how that can be frustrating as a patient. It's, well, I'm calling and now I'm getting told that I have to, the next open availability is not for another week. Here's the why too. I think it's very important for our providers, our nurses, our care team in general. We want to, during those visits, we want to make sure that we have allowed time to fully go over that assessment. In annual, it really should take about that 30 minutes. Sometimes and something with those annuals is it's not just lab work to us. It's not just a number to us. It is, ooh, you're off here. Let me listen to your lungs. Let me get a full evaluation, because that's what we do. We care for those patients. And that's why sometimes it might be a week out. And it's truly because we want to do a good head-to-toe assessment on you. And that's because we care.
And which is our tagline, by the way, we care for life.
Yes.
So thank you for leading me into that. My guest on the podcast today is Trama Vetter. Trama is the Director of Clinical Services here at CCMH. We're talking about the clinic and some of the general questions that arise from time to time about how all of that works and fits together and what we're doing right now as far as patient care is concerned. One thing that people do bring up to me from time to time is that our clinic operations, because of our current clinic expansion project, that our clinic operations right now, for the most part, have been relocated to what used to be and will be again our specialty clinic services area. But I think we have to take more of a long view on this, in that it's going to be a while before this is done yet, about another 18 months. But by the same token, when that's done, we'll be able to actually add appointments, we'll be able to add providers, and it should, in the future, make it easier for people to access the care they need.
I agree with that. I actually am calling this state our beautiful chaos that will have an amazing end result. I will be honest, the construction for the clinic expansion, it is moving along amazing. We are actually seeing a lot of progress, but it's hard for the patients to understand that. What they see right now is a building that's wrapped in white right now, but I will be honest, behind those closed doors, we are making changes that are going to serve the community, and again, it's the beautiful chaos that we're in right now, but the end result is truly patient focused. And we know that we're in a struggle. I'll say again, a little bit of a struggle right now, but we're making do, and we're not delaying that patient care. Again, the end result's going to be amazing.
And we have added, as you noted earlier, we've added a couple of people. First of all, Dr. Benjamin Burkett, who is here, has been for about the last 9 months doing orthopedics for us, and I think doing an excellent job. And Dr. Richard Malazek, or Dr. Rick, as I prefer to call him, who's been here as a general surgeon. And it sure seems to me, Trama, like we're able to take care of more patients locally for things that they really need.
Absolutely. And I think that's the biggest thing too, is again, we're expanding. We have providers that are willing, and we see the need. We really do. We see the need of the community. And so I hope that people get away from this podcast that we see you, and our goal is to provide that care for you and close those gaps.
So if there's anyone who's listening today who's wondering whether or not they should call for an appointment, they're concerned about the construction, or they're concerned that we don't have appointments available, or they're concerned that maybe the provider they used to have has either retired or they've relocated somewhere else, what would you tell them about making that call and coming to see us here at CCMH?
Yeah, I think that CCMH is really, it's full of warm faces. We have excellent expertise, and our number one focus is patient care. I'm going to be honest, each day that I walk in, I feel a sense of pride, warmth, support. I strongly encourage anyone listening to make that phone call, so they can not only hear, but maybe they can also feel what I feel. I'm going to be honest, when I put my name badge each day, I'm honored to do that. I'm honored to be a part of this team, and I'm eager. And so if there are any questions, anything like that, I strongly encourage them. I encourage those patients to reach out to me if they need to.
Yeah. We've got a couple of different ways. If you need to make an appointment, a couple of different ways to do that. One is we can go through the website. We've got a request an appointment right on the homepage, or they can call a phone number.
Absolutely, yep. 712-265-2700.
And if anybody wants to visit with you, they just call that number and they'll get you connected.
Absolutely.
I appreciate your time today, Trama. Thank you very much.
You're welcome. Thank you so much.
My guest on the podcast today, Trama Vetter. Trama is the Director of Clinical Services at CCMH. We've been talking about healthcare delivery in the clinic. If you have questions or if you need an appointment, as Trama said, you can call 712-265-2700, or you can go online at ccmhia.com. We have a place where you can send us an email if you need to ask a question, or if you'd like to request an appointment, you can do that right there on the homepage. I'm your host, Don Lintzman, for the Here's to Your Health podcast. Thank you for listening today. Have a great day.